Thank you, Andy, for that sweet presentation. Due to time constraints, we will move right on to Brian Cho's poster.
Hi, my name is Brian Cho. Have you ever had a scar that didn't heal properly, or turned red, or even became painful? You might think it's nothing serious, but sometimes it could be due to something called scar contamination. Today, I'll explain what scar contamination is, why it happens, and how you can prevent it. So first, I'm going to explain what is scar contamination. So scar contamination happens when bacteria, toxic chemicals, or heavy metals prevent a scar from healing properly. It's not just a cosmetic issue. If a scar gets contaminated, it can lead to infections, chronic pain, or even serious health problems. For example, a contaminated scar can be swollen, infected, or develop into a larger and more painful wound over time. And there are three main causes of scar contamination. First is poor wound care. If you don't clean your wound properly or keep touching it, bacteria can enter and cause infection. I think everyone here knows that our hands carry like thousands of bacteria and germs. So it is really important to wash the scar and your hand before you touch it or do some medical cares. Second, exposure to harmful chemicals. Toxic substances like pesticides or cleaning agents can damage the skin and delay healing. For example, if you touch clean products with gloves, without gloves, the chemical can irritate your skin and worsen scars. Third, heavy metal exposure. Toxic metals like lead and mercury can accumulate in the body and affect skin healing. People working in construction or facilities should be especially careful. And now I prepared 5 symptoms of scar contamination. Since health risks and symptoms of scar contamination is basically the same thing, I analyzed into 5 main symptoms that has really bad effect on it. So first is redness and swelling. If your scar stays red for too long, it may be infected. If the scar is something like a skin cut or something that causes blood from inside your body, the blood shell will form on top of the scar and it will protect your scar from the harmful environment. Second is persistent pain. A scar shouldn't hurt after it heals. So if you feel the pain from a scar that has been healed like 2 months ago, it's a big sign of that the scar has been contaminated. Third is pus or unusual discharge. Yellow or green fluids from your scar coming out from your scar is a sign that your scar has been infected, and in this case, it is really worst case, so it's really important to go see a doctor or have a medical support. Fourth, itching or burning sensation. Mild itching is normal, but excessive itching may mean it is contaminated. And lastly is a general fever. If the infection spreads to your scar, it will gonna have like a general effect on your body health, so you might feel sick overall. And next, we're gonna learn how to prevent scar contamination. So first is keep wounds clean and avoid harmful environments. Wash the scar with water and antiseptic and use antibiotic ointment. And also reduce exposure to harsh chemicals like pesticides or cleaning agents. Second is wear protective gear. Gloves and masks help prevent contamination a lot, so practice good hygiene with the gloves and masks and even more protective gears. And lastly, this is really important, see a doctor if needed. If you feel it's fine, but you have like the symptoms that I mentioned before, it is really bad because it's been contaminated or infected. So if you have those symptoms, go see a doctor right away. Scar contamination is more than just a skin issue. It can affect your overall health. By taking simple precautions, you can prevent scar contamination and keep your skin healthy and safe. Thank you.